The good news about vaccinated people are if you look at the protection against severe disease leading to hospitalization and unfortunately sometimes death, the vaccines still work really quite well against the Delta variant. We are concerned that we are seeing more so-called breakthrough infections. That's something we obviously don't want to see. We're dealing with a highly transmissible virus. This virus is clearly different than the viruses and the variants that we've had experience with before. It has an extraordinary capability of transmitting from person to person. Fortunately, if you look at these so-called breakthrough infections, which by definition means an infection in someone who has been fully vaccinated, that usually the overwhelmingly vast majority of these infections are either asymptomatic or mildly symptomatic, which is compatible with the fact that it looks very much like the vaccines do continue to protect quite well against hospitalization and death, even against the Delta variant.
But what about transmission? What do you do if you're someone like me with 2 toddlers at home and have been going out to restaurants and going back to work? Do we need to change our behavior because we're seeing breakthrough infections on the possibility that we could transmit them to unvaccinated kids?
Well, that's a question that is very appropriate and keeps getting asked over and over again. The broad overall CDC recommendation is that if you are vaccinated, you are protected and you don't need to wear a mask indoor or outdoors. But many local authorities, and I think the prototype example of that is LA County, Los Angeles County, which because of the high level of transmission and infection there, they are saying that if you are fully vaccinated, even if you're vaccinated, it's suggested that you wear a mask when you are indoors in a situation where you have a level of dynamics of virus in the community that's high. So I'm not sure exactly where you are or what the dynamics are in the region that you are, but you might want to consider, if you want to go the extra mile of safety, even though you're vaccinated, when you're indoors, particularly in crowded places, you might want to consider wearing a mask.
Why shouldn't we just have a national mask mandate again if cases are spreading in every state in this country among the vaccinated and unvaccinated in particular?
Well, that's a question that is asked frequently and appropriately. I don't believe that we are going to see a central mandate for masking because there will be a lot of pushback on that. What I do think you will be seeing is that there will be local mandating, namely situations like colleges and universities saying, unless you want to be excluded from coming in, you've got to get vaccinated, or even business enterprises might be saying that. I think as the vaccine gets fully approved by the FDA, as opposed to just the emergency use authorization, that you are going to see a lot more local mandates. It's really unfortunate about people sometimes say, well, it hasn't been fully approved. The data is so overwhelmingly positive for these vaccines that I would be astounded if they're not approved. So, you never want to get ahead of the FDA. That's their decision. But I would imagine that we're going to see approval of these within a reasonable period of time.
So possible to see more local mandates when it comes to mask wearing over the months ahead. What about stricter measures than that? What are the chances that we go into more forms of lockdown again?
I don't really see that, Wilfred. I don't see that on the horizon right now. What I do see is increased testing and increased local mandates and a big push to get people vaccinated. The frustrating part about this, from a public health standpoint, is that we have the tools to stop this. And if we do get more people vaccinated, you are going to start seeing a downtick again in the infections. It's really quite frustrating. These vaccines work well against this virus, including the Delta variant. We just need to get more and more people vaccinated. And hopefully we're starting to see perhaps a change in that people, be they people on TV and others who've been saying that they're not particularly enthusiastic about vaccination, are now starting to change a bit and starting to recommend to people to get vaccinated.
With that in mind, Dr. Fauci, you used the term there, public health. Does it become actually a private health issue for those that have chosen not to get vaccinated, such that if we do see deaths pick up later in the year, we shouldn't react to them in the same way that we did last year before it was just broadly a public issue and there was no real debate as to the decision-making of individuals?
Well, you don't want to see anyone get seriously ill and die. And you don't want to say, well, I told you so, you should have got vaccinated. That's certainly not what I would consider an appropriate public health attitude. What we try to do is get people to look at the data. And the data are really striking. In the United States, 99.5% of the deaths from COVID-19 are among unvaccinated people. That is a statistic that just speaks for itself, that if you are vaccinated, you are accounting for an extremely small proportion of the people that are vaccinated. If you are unvaccinated, you're accounting for 99.5% of the people who die from this virus.
Where are you, Dr. Fauci, on how urgently we might need a third shot or a second shot if you got the J&J vaccine, and whether it's the same one you got or something that directly targets Delta?
Well, again, that's a question that's being frequently asked. We are looking now at the data of what we call the durability of protection. You're talking about boosters under two scenarios. One is a person who's had initially a very good immune response, but you want to make sure that it lasts. And you don't know whether it's going to be 8 months, a year and a half. So you follow individuals both from the laboratory data that can serve as a surrogate or parameter of immunity and protection, or you look clinically as to whether or not you're getting more and more breakthrough infections. The other reason for a booster, which is being considered and being tested, is that those people who have underlying conditions of being a low immune response, namely transplant recipients or people receiving therapy for underlying diseases like cancer or autoimmune disease. Those individuals may not have had a very adequate immune response to begin with. And what you need for them is maybe an additional shot that is part of the total part of their regimen. So there are two reasons for that. Both of them we are pursuing in trying to find out to whom, when, and if they should be given a boost vaccine. So that's a work that's in active progress right now.
Dr. Fauci, what's relatively speaking more important, helping the developing world get their first shots or making sure Americans have the option to have a booster shot where necessary?
Well, I get asked that question a lot. It's an obvious question. And I think we are capable of doing both. I think if we put resources into it, and all of the countries who have resources, the developing world, puts in enough resources to help the low and middle income countries to get vaccinated, I think you can do both. I don't think it has to be a choice, one or the other.
What happened to herd immunity, Dr. Fauci? Or did that just go away with these new Delta variants?
No, I mean, when you have 1/2 of the entire total population of the United States that's been vaccinated, meaning the other half is not. Even when you include in the other half people who might have been infected and might have some degree of protection, we still have not reached that critical area where you have a comfortable blanket of protection over the community. And that's the reason why it isn't whatever happened to herd immunity. It's why are not people, more of them, getting vaccinated so that we can reach herd immunity. The easiest way to get to herd immunity is to get the overwhelming proportion of the population vaccinated.
So do you have a projection for when we might see that, given what we're seeing with Delta?
I think it's impossible to project. We've done very well with vaccines, particularly among the elderly. More than 85% of individuals 65 years of age or older have received at least one dose. We know when you look at adults that we are now close to 70% of 18 years and older who have received at least one shot. So in some respects, we're doing very well. But we've really got to do better. And I can't project when we're going to get there because we still have to get to the point where we're convincing a lot of people who are being recalcitrant to getting vaccinated to turn around and get vaccinated.
If we were to rewind the clock, Dr. Fauci, let's say 6 months or so, when you knew there'd be other variants to come, but you didn't know precisely what their characteristics would be, how bad are the characteristics of the Delta variant relative to your worst fears 6 to 12 months ago? And do you think there will be almost inevitably another worse-style variant to come down the line? Or if we do manage to reach herd immunity in the months ahead against this variant and others, could we be home and dry but before that kind of worst scenario emerges?
You know, all very appropriate and good questions. The fact is that this is a nasty virus. It has the capability of very efficiently spreading from person to person. So 6 months, a year ago, we were in the situation where we say, we hope we don't get a variant like that. Unfortunately, we do. The second part of your question is, what about additional variants that might be even worse? Well, there's a very, very important tenet in virology, and that is that viruses don't mutate unless you allow them to replicate and spread in the community. You give them ample room, ample time, ample opportunity to mutate and get a new variant. So the easiest and best and most effective way that we can prevent the emergence of a new variant and crush the already existing Delta variant is to get everybody vaccinated. So as I've said before, we have the solution within our grasp. We've just got to go for it.